we live in a very exciting time for head and neck cancer. I think for a long time we were waiting for something to open the future for patients, improve the future of care for patients with head and neck cancer. And finally, immunotherapy came along since 2016, and we've seen the promise of immunotherapy, the fact that it is a modality that improves outcome, but also preserves quality of life, which is an important thing for our patients with head and neck cancer. And so I think now that we have this tool, the next period of time will be focused on how best to use it, specifically, I think, in patients who fail the first-line immunotherapy approach, because this is a large group of patients, and still the majority of patients fail this modality. But we're still struggling to understand what does fail mean in terms of, do they really fail for good, or can we reinstitute a situation where the tumor may be resensitized to immunotherapy, and and this is where the combination question comes. What is the best sequencing? What is the best combination? And that's going to take a while, I suspect. We're not going to come to an answer by ASCO 2021. I think if we're lucky, we will see some generation of large trials that will be looking at this and examining this question. But I don't think we will have an answer to this question for a while, and I don't think the first line, regimen challenge, current standard, which is essentially the single agent pembro versus pembro and chemo, will be challenged for the next year or so.